Okay, you can go ahead and bite down. Keep biting. Okay, let's do it. Let's give you your first shot, Doc. I'm going to use a device that vibrates. This helps distract you from the anesthetic. Okay. I'm going to give it a little bit more on the palate.
Okay.
Sorry, Doc. You know this is going to pinch a little. Just a little bit, okay? 5, 4, 3, 2, and 1. That's it. That's it. That's it. So here we have a missing tooth. Yeah, extraction after a root canal that had gone bad. Quite often, yeah, this is one of the most common reasons for placing an implant. Root canals that have gone bad, they're infected, they're not worth being retreated. So we can now restore these teeth with an implant, and it gives you much better prognosis. An implant can go 30, 40, 50 plus years once it's integrated with the bone. So truly a very good solution if you're considering replacing a bad root canal. As you can see on the x-ray, patient has a decent amount of bone. There are some areas that are not fully dense. Yeah, so there's some techniques that I do for that. We compress the bone in order to create more dense and better integrated implants. So we'll get started. Our patient is ready. Roy, are you ready for placement?
Yep.
Do you feel enough anesthetic in the area?
Yes.
Wow, amazing. Let's get started. Now, everybody thinks implant placement is very scary or it's very difficult. You'd be surprised. This process is going to go very fast. All right. First, we'll create an incision or a space for placement of the implant. First step. Okay. Roy, please turn towards me. Thank you. Thank you. That was perfect. That's the perfect spot. Part of the first step in placing an implant, you want to create the space where the implant exists. So sort of like carpentry. You create a small incision hole where the drills then go through. So now we have already decided, before even making the first incision, what size of an implant I want to place. We're going to do a short but fat, wide diameter implant. So now we prepare the bone in a way to accept that implant. Think of it a lot like carpentry. Yeah, you want to hang a painting from a wall. You have to prepare the space where the screw lives. So this sort of is that exact process. I've made a space now for the drill bits to go. Continuing, we have now made the first incision. Now we are expanding it, allowing this bigger drill bits to go in. Okay, suction please. Thank you. So like we discussed, the bone felt a little soft. Yeah, we can tell this was a recent extraction. Yeah, so the bone hasn't become dense yet. For that reason, I'm going to use a soft bone protocol for placing of this implant. I will only expand or drill the bone to a size of 3.5. Let me see. Let me pick my location, my angle. Yep, that's it. How does it look from that side?
That looks great.
Yeah, angle is good.
Yeah.
That's it. Okay. Now we actually go into placement. So we have selected our implant. Yeah, I use an implant that heals very fast. These implants have been treated in a way that their surface is etched. It actually absorbs blood. Yeah, so when you place it in the bone, you place it in the mouth or inside the bone, the blood that's in there fuses into the implant. So here we pick up the implant. As you can see, I'm gonna adjust the setting of my machine to slow it down for implant placement. And now we bring the implant close, place it in the hole that we prepared, and drive it in. Good. We got a lot of torque. Please keep that retracted like that. I'm going to hand drive the rest of the way. Beautiful. So when I place an implant, we like to get maximum torque. Anything between 35 to 40 Newton meter of resistance. That allows very stable and very desirable retention levels for integration. Anything more than that can cause bone necrosis, but at this sweet range, you get a really good adhesion to the bone. That's it. Okay. Let's take a look. We're smack in the middle. Angle looks good here. Minimal bleeding. Yeah. Let me drive this another half a turn, and I would like to get an X-ray.
Okay.
How did you feel, Doc?
Good. No pain.
So this is we call this the implant mount. This is what allows me to place the implant in. So now that we've placed it, we can remove this and put a healing cap that allows the gum tissue to heal around the implant. I'll select one. Let me remove this. Okay. Now recover your implant. Roy, you're all done. You can close your mouth. That's it. Congratulations. That's it. That's your first implant. It's going to take about 3 to 6 weeks for it to heal. You don't have to do anything different. I recommend some vitamins, vitamin C, D3, and K2. These are very beneficial during the implant healing phase. Yeah. I'll give you some medications to take, some antibiotic and things of that nature. Otherwise, yeah, you're going to have a tooth very soon.
All right.
Please sit them up, yeah? And take the X-ray, please.
Yes. Doctor, the X-ray's ready.
Oh, great. Let me come in and take a look.
Okay.
Oh, very nice. Yeah. Looks good. So here's your implant. Yeah, you've got a nice size, yeah, long and good width implant that's placed directly inside the bone, perfectly centered between the two back teeth. What you see here, that's the healing cap that allows your gum tissue to form around the implant and not collapse on top of it. We'll need about 6 weeks of healing, yeah, just a month and a half, and then we can put a tooth on this. And looks really good. Surgery went really well. Yeah, minimal bleeding. You're gonna have very little downtime. I suggest taking a lot of vitamins to help the healing process go even faster. And you have no other issues other than that. Any questions for me?
Perfect. No, not
Yeah.
at all.
Did you like the experience?
It was great.
Yeah?
Much nicer than I expected.
Awesome. Amazing. Maybe we'll do all the other teeth too.
Yeah.
Yeah.
When it's time.
Thanks, Roy. I appreciate you having you at the office, man. Always a pleasure.
Thank you very
All right.
much.
Go ahead, sit this gentleman up, and we'll see him outside.
Sounds good.